Hi, this is Marybeth Van Horn. Welcome to Nurse Chats. Listen, what is the benefit of a bath? How many teenagers, little kids say, I don't want a bath. Why do I have to take a bath? And it's funny because I don't know what the answers I gave my kids, but usually was because I told you so. Get in the tub. We're going in the tub now. But I was talking to an elderly friend of mine several years ago, and she said basically she's something like, we don't need to take a bath in the nursing home because we're not going anywhere and we're inside most of the time, and we don't really need a bath every day. So we get a bath once a week, I think, or twice a week, or whatever she told me. And the more I thought about that, I really understood that it had more to do with the staffing than it did with the benefit or lack of benefit for taking a bath. Okay, so what are the benefits of taking a bath besides becoming clean of bacteria? And bodily bacteria smells. So, generally, you can even have bacteria in your mouth, in your bowel, in your, everywhere else. We all know that bacteria stinks. If you go too long, you're going to get what they call BO, body odor. But beyond that, when you're bathing, you are moving some lymph. You are moving, hopefully a washcloth or something across your body, and you are stimulating circulation. You are moving your body, so you're getting more activity. Taking a bath means sometimes that you can get what we call hydrotherapy. You might have that nice hot water running on a sore shoulder or neck and be able to move better during the bath or after the bath. You could have, I'm talking about showers equally with tubs, okay? You're not having water running over you on the tub. But I'm just saying, hot water can be therapeutic. I worked for a long time. It's funny, I have all these hats I wear, but I was a personal trainer at one point. So believe me or not, it all connects. There's a reason I did everything I did in my career and in my life. But I owned a fitness studio, and I became very well known as a personal trainer in Colorado. And a gentleman came to me from a very professional background in sports. And he was an awesome client. I worked with him for quite a while. I had a couple of Olympic athletes that I trained, and so it wasn't uncommon for me to work with professional athletes. But he, first of all, was an incredible client because an athlete that's a professional will do what their trainer tells them to do. That's, again, just like everything else I said in one of the videos about resistance. The human being will resist for some reason, and you're like, no. People would say to me all the time as a trainer, I know. I mean, you know what? What do you know? You're better off becoming very humble and being like putty in my hands, because I can see what you can't see about your body or your mind or what I'm watching as I'm working with you. That's why an athlete gets a trainer, and that's why they use coaches. It's not like they know. In fact, they are the first person to say they don't know, just so you know. And they're professionals. I trained professional models too, and the models were awesome clients too. They wanted the result, right? So if you want the result, stop thinking you know everything and listen and do. And so that athlete was telling me that they'll do anything to get over an injury or to prevent injuries, of course. And so he introduced me to what they call cold bath. And I think we've seen Peyton Manning on some commercial in an ice bath. They actually use ice in a tub. And so that's another example of hydrotherapy. It's amazing. I started doing it. I would take a shower and I'd be in hot water and getting my muscles all full of circulation and loosened up. And of course the blood flow, the capillaries are all like completely bulging and wide open. And we all know what increased circulation to a part of the body means. It turns red. It's got a lot of blood flow going on. Well, then the next step is to cool down, and so you don't have swelling and too much fluid in the area. So what I did to try to experiment with cold bath was I stood in the shower, had my hot water therapy, got my arms and joints moving, and then I started going cooler and cooler and cooler with the water until I could tolerate it. And then I plugged the tub and sat in the tub while the cool water filled it. And I then eventually switched the valve from shower to tub and kept adding cold water. Now I could tolerate that. I had a lot of inflammation, but some people can't tolerate that. But the point is that bathing has many benefits, showering and bathing, okay? Hydrotherapy, cleanliness, movement, circulation. Other people can probably think of many more than I'm coming up with, physical therapists and etc. But Epsom salts in a bath, can draw on. If you don't know what Epsom salts is, but it's a salt, so it's an ionic solution, so it can draw toxins or extra fluids from the body. So the skin is the largest organ of the body, right? So the skin matters. So stimulating the skin, exfoliation, using a washcloth, not just your hand, getting the dead skin cells off, that's important too. If you can't reach, get the scrubby on the stick, so you can get all areas, and do use that. If you need to use people have a seat in the shower. I was talking to an occupational therapist. I think I was talking during one of my nurse chats about having chest pain a couple weeks ago. That turned out to be fine. I didn't have anything wrong with my heart, but the occupational therapist was showing me energy saving ideas to help me because I was having fatigue. It turned out I had a bacterial infection, but I was having fatigue. I got bit by a bug and got a bacteria, which was causing a lot of problems for me. And I got bit on my foot. But anyway, when I went in for chest pain, I didn't connect my foot with my chest. So I didn't tell him that I had a bug bite. But anyway, she was trying to give me energy saving techniques and ideas. And she said, use a seat in your shower. And I kind of, again, rebelled because I'm like, oh God, I can't, I was in rehab so long with my leg. I mean, anything like that makes me think of either being old or being injured. I didn't like the idea. But then I got it. She really was talking about conserving energy. And then in the shower or, if I needed to raise my foot. So I actually bought a shower stool that I like and that's stable for me, and I have it in my shower. I'm able to because my shower is big enough. In the tub, of course, getting in and out of a tub is a big deal. So if people have disabilities and can't get in and out of a tub, they have assistive measures for that as well. I personally, if I can't get out because I've just squatting my knee with both knee replacements isn't easy for me, so I just literally turn over towards my stomach and get on my knees and hold on to a bar in the bathroom and get up that way. And there's nothing wrong with having a bar in your bathroom. Again, doesn't mean you're old and disabled and all that. It's a great safety measure, but it's also a great assistive device.